Off the top, though, we have 3,098 cases of coronavirus in Victoria. That's 165 new cases. There's some reconciliation in the data, so the global number's only gone up by 156, but there are in fact 165 new cases. 30 connected with outbreaks and 135 that are under investigation by our public health team. There are 477 cases of community transmission, 932 active cases across the state. 40 Victorians remain in hospital, with 9 of those in intensive care. Given it was the last day before the Stage 3 restrictions were reimposed, it's not surprising that our test numbers off the almost 30,000 yesterday were back closer to 22,000, 21,785. But that takes us to 1,030,462 tests since the 1st of January. Again, I want to thank everybody who's come forward and got tested. I want to thank everybody who is out there following these rules. We know and understand it's difficult, it's challenging. No one's enjoying this. Nobody wanted to be in the position that we're in, but we simply have no choice as a state to follow the rules. And even in regional Victoria, there are still rules in place, and they are just as important as following the rules in metropolitan Melbourne and Mitchell Shire. If we don't all play that part, if we don't all continue to work together and take this as seriously as we have to, then we simply won't bring stability to these numbers, let alone drive them down and get to the end of this 6-week period and begin and then recommence the process of opening up. So everything is on the line here, and we need to make sure that we're all playing our part. And I want to be really clear to thank the vast majority of Victorians who are taking this seriously and are working with us to get this job done. As I said a moment ago, nobody wanted to we didn't want to find ourselves in these circumstances, but this is where we are, and we have no choice but to confront the reality of this virus and its transmission across the community, and to take the very difficult steps that we've taken, and then all of us to adhere to those rules. Our Victorian community benefits from that, your local community benefits from that, your family and every family benefits from that in so many different ways. Ending these restrictions sooner than would otherwise be the case. If we don't drive these numbers down, then 6 weeks can become longer. If we don't take this seriously, then many people will become gravely ill, and then we know the tragedy that follows soon after that. So for all of those reasons, and many more perhaps, I want to thank those who are doing the right thing, and I want to appeal to all Victorians. Let's keep working together. Let's keep taking this seriously. We simply have no choice but to do that. Now, in terms of the towers, we have conducted some 2,515 tests, which is a massive effort when you consider the challenge of moving up and down these high-rise towers, the sheer amount of work that's been done to get those tests taken and processed. There are 159 positive cases out of those tests. There are also a number of close contacts. There are, in essence, 3 groups within those 9 towers. I'll ask Brett to speak to this in more detail, but essentially 9 Pampas Street and 159 Melrose Street both have 0 cases and will be able to move to the Stage 3 restrictions that apply to the rest of Melbourne. Home, except for the 4 reasons. Now, acknowledging that this is in some respects akin to an aged care facility, there will be continued support and continued protection for those residents, given that their age and for many of them their health status makes them especially vulnerable. Beyond that, we have another 6 towers that have relatively low numbers of cases, and then we have 1 tower that has very substantial numbers of cases and potentially close contacts right throughout that tower. To take you through the science of this and the different approach we're taking to each of these 3 groups of towers, I'll ask Brett to speak to that now, and then that's the what we're doing and why, and then I'll ask Lisa Neville, who is essentially in charge of our response on the ground, to explain to you how it is we will get that job done.
Rose Street can really go to the same settings as for the rest of Metro Melbourne and Mitchell Shire. So a stay-at-home direction applies, but otherwise able to go out for those 4 reasons. but they are vulnerable individuals in those towers, and they need to be extremely mindful of the potential risk in bringing back virus into those settings. So going out has to be for essential reasons, and all of the usual precautions that we would tell anyone in Victoria need to apply especially to these elderly residents. For 33 Alfred Street, where there are at least 53 confirmed cases, and there are usually 2 or 3 close contacts for every confirmed case, we need to recognise that there might be 20-25% of individuals in that particular tower who end up developing coronavirus, and potentially more. So that has, much like an aged care facility, been designated as everyone requiring quarantine. Obviously 5 days of quarantine have been done already, where people have stayed in their apartments, but there are another 9 days that will be required for people to be in quarantine in that particular tower. When one is in quarantine, you can go out for medical reasons, obviously. Anyone who develops illness and then becomes a case needs to go through whatever period of time until they're cleared of the virus. If they require care outside of that tower, then obviously that will be facilitated. Anyone who requires emergency assistance can obviously get it, but they need to stay in quarantine until a 14-day period is completed. For all of the other towers, and we will have new cases emerge over coming days, but the numbers are relatively less. For some, just a few cases; for others, several. We really need to have an intensive monitoring program. Obviously, for all of those cases in those towers, they need to remain in isolation. For all of their close contacts, they need to remain quarantined. We will try and facilitate movement to more appropriate settings if it's very difficult for people to isolate. That will be voluntary, but it will be strongly encouraged, because there are some apartments, as you'd expect, where it's pretty difficult to isolate from the remainder of that apartment. The other thing that will need to be supported is all of the infection prevention and control. So there'll be hand hygiene stations on every floor. There'll be very substantial deep clean every day, as well as cleaning of high-touch surfaces several times a day, so lift buttons and in stairwells and the like. The other thing we will obviously flag with all residents is a daily check-in, a single point of contact, and really emphasising that anyone who develops symptoms at any time, there'll be testing available so that anyone who becomes symptomatic can have that test, and then if they're identified as having coronavirus, can continue their isolation. Obviously their apartment, their close contacts will require quarantine for a period thereafter. But these are the measures that we know will get on top of this. The expectation is that there will be more cases. Obviously we've tested a lot of people over the last 5 days, but there are still people who are going to be incubating illness. So they haven't tested positive yet, but in the next couple of days they may well develop symptoms, test positive, and will need to continue to isolate them and quarantine their close contacts. But the risk in these settings is not insubstantial, and so these are proportionate measures. As many are aware, when we've got a case in an aged care facility, every resident is considered a close contact. They are all tested. They all go into a quarantine period for 14 days. They're tested on the end of that quarantine period, and it's only then that aged care facility can really come out of a lockdown. So it's not dissimilar to that kind of high-risk setting.
To run back through that before I ask Lisa to talk about all of the support and the other logistics work we're doing to facilitate this public health response. Melrose Street and Pampas Street, stage 3, same as the rest of Melbourne. Every other tower except for Alfred Street, they will be treated the same as every other resident across metropolitan Melbourne. Stage 3 But of course, if you've tested positive or if you are a close contact, then you must isolate at home. And we will provide support to each and every one of those people who have tested positive or who are a close contact. If it is appropriate, then they will be moved to an alternative setting. For instance, if they were living with somebody that they needed to stay away from because of a health issue or whatever the circumstances may be, we would, and that sort of distance would not be able to be achieved in their current residence, then we will move them somewhere else, and we'll be encouraging as many of those residents to do that as possible. That accounts for 8. The Alfred Street Tower, though, is a different case, and the public health advice is that there are such numbers of positive cases together with known close contacts that the assumption has got to be that everybody in that tower is a close contact of someone who is positive. On that basis, just like every other Victorian, they will need to remain in their flat, in their unit, except for medical care and for supervised daily exercise. We will support each and every one of those families. The 14 days is the balance, so the 5 days that have already been done, plus a further 9 days. And that is an abundance of caution approach that not only protects the welfare and the well-being, the health of all of those residents, but also protects public health as well. We are in a strategy at the moment to try and drive down numbers, and we therefore need to take some hard decisions, some difficult decisions, but those based on medical advice in order to achieve both good outcomes for individuals and their families, but good outcomes for communities and indeed our whole state as well. And that's exactly what these decisions represent. To talk you through some of the practical matters in terms of groceries and other support, medical support, all of those things, I'll now throw to Minister Neville.
Thank you, Premier. Good afternoon. So this has been pretty tough for a lot of residents at the Flemington and North Melbourne high-rises, that people's homes being locked in there for 5 days. It's been very tough. And for some, it's going to continue to be tough over the next 9 or so days. What I would say to people, though, having been out there yesterday at both sets of flats, is that there is such an extraordinary amount of outpouring from the community, from all our agencies, our volunteers, our career agencies, in terms of wanting to support people. So I hope people take heart by the fact that so many Victorians have reached out and want to be part of this and share part of this with those residents. As the Premier and the Chief Health Officer said, we've got 2 towers that are about to, if not already, have been lifted from the directives and are now at stage 3. Those 2 towers will now receive quite significant in-reach help, like we would do with any other aged care facility. So we will provide support, health and other support to those residents who are already vulnerable and are probably not really leaving their homes anyway. So we will provide all that support that is needed, and that will be largely a health response there. There will remain some police just around to ensure public safety and people are following the restrictions. In terms of Alfred Street, and I think this is the really difficult one, and I know that this is not an issue that anyone has taken lightly. I know the Chief Health Officer hasn't, none of the agencies, about ending up in a position where we've got another 9 days where people are locked in their homes. This is really going to be really tough for them. What I can assure them of is that we have a plan in place. It's not just a policing plan. There will have to be police there to ensure people's safety, but also to ensure compliance with quarantine. It's very clear, the message from the health authorities is very clear. We can't allow people to be moving across floors or in lifts because it is such a high-risk environment in that particular tower. We will have that policing support, but we'll also have support from health. There will be care teams, there will be support teams that are available to people as they get through a really tough 9 days. We're also moving our food, both production, generation and distribution system, and we'll do that over the next couple of days to AMSA, the Australian Muslim Social Services Association, that is based down there near North Melbourne. They are doing already a massive job, and I know last night they were able to deliver a significant number of meals to people. So we will support them to get groceries, to provide those groceries, to provide both perishable and non-perishable food, and we'll have a much more scheduled system around that, and they can also deliver those, and they, from experience, it's about a 45-minute delivery time through those towers. So I thank them for putting their hand up. That means we are able to deliver more appropriate food, more culturally appropriate food, and we have a better, they've got a very strong connection into those communities. In addition to that, we'll continue to provide our medication, etc. These residents in Alfred Street, one of the differences will be they will be able to access exercise and fresh air, and we'll be working through that with the health teams and with the police about how we do that as safely as possible from a health perspective. We need to schedule that in a way where you don't have large numbers of people all at once going out, but that is obviously a very important part of people's wellbeing, and I think that will at least help a little bit during the next 9-day period. In terms of the remaining 6 towers, so for the vast majority of people in those towers, they move to stage 3. At this stage, it will be about midnight tonight, and the reason that it's not immediate for those residents is that we can't afford to see a couple of thousand people try and exit straight away when they've known they're able to move out. That would have massive issues around social distancing and potential risk to the spread. So we are making it later so that we've got a more ordered way in which people can leave. So food will still continue to be provided, and there'll still continue to be significant police presence in that area. We'll also, in terms of those who are required to quarantine, those who have COVID or who have a close contact, we will be knocking on their doors and strongly encouraging people to take up the offer to go to hotels. That will be available from midday tomorrow. In fact, for those who really want to go now, that is available tonight. But people have an opportunity to think about it, to actually prepare. We will then be able to transport people through Ambulance Victoria, those who have COVID, and St John's Ambulance for those who are close contacts. We do really encourage that. That is the safest for you and the safest for everyone else in those towers. However, if people are choosing to stay, there will be, as police do out in the community, no different to anyone else in their home where they're required to quarantine, regular checks on people, whether they are abiding by those quarantine. There will be care teams that will be supporting each of those people who are quarantining. But I can just strongly emphasise, if you are going to choose to stay, you must quarantine. This is so important to the health and well-being of the rest of the residents in those towers and also in that broader community. In terms of the other support that will be available on site, there will be medical teams. There will also be, this is across all the sites, there will also be health temperature checks, there will be symptom checks available, there will be regular testing available for people as well. We'll be closing all the shared laundries across all the sites, and we will provide laundry support services, and that will be done through a company to ensure, one source in and out. We don't want people in those shared spaces, and as the Chief Health Officer said, there'll be deep cleaning on every floor as well as regular checks on spot points. So for those residents who are in those 6 towers who are not a close contact or positive, you will be able to go about as per every other Melburnian from about midnight tonight. But again, you've got to follow those restrictions, those stage 3 restrictions, and we'll continue to have a lighter police presence in those 6 towers. That'll be much more a health response than it will be a policing response, but they will be there for public safety and to provide any assistance that communities want. This will be a program that is led with the Emergency Management Commissioner out of EMV. It is a significant operation, and we'll continue to work with all the health experts to make sure that we're meeting people's health needs, keeping people safe, as well as making sure that in terms of a broader public safety that we have the resources that we need there. again, can I thank our police? Can I thank all those volunteer SES, Lifesaving Victoria, Forest Fire Management, Fire Rescue Victoria, who have been delivering food. I think we've got 210 people there today just delivering food. So I thank them. I thank the local community, AMSA, for putting their hand up around food delivery. That's going to be such a big difference. And can I particularly thank the residents? This has been really tough. And, you know, you have done this not just for your own health, but to help the rest of Victoria. So I thank you again.
Number we've seen. Is this what you expect?
I don't know what to expect each and every day. I always hope that numbers will turn the corner. We've obviously had some changes in recent days that I would hope have helped to suppress transmission, but it's only with these stay-at-home directions that I really have confidence that we can properly drive it down. So I still think we're right on the cusp. It's a number that I absolutely hope continues to be driven down. I wouldn't expect that this is the peak. I absolutely keep my fingers crossed that it is. It would be most reassuring if in the next week we can see numbers go down, but there's absolutely no guarantee. And I've emphasised so many times that we can't be complacent. And when we've had a day that's gone down, we've seen another day where it's gone up really significantly. And part of the reason for that is sometimes that outbreaks get significant new numbers. We may well see from these towers more confirmed cases from overnight. So, you know, we'll keep watching those numbers very closely. Yeah, there is an epidemiological link between Altaqua and the towers. I think I was asked yesterday, do we know how it got into the towers? No, we don't. An epidemiological link between Altaqua and the towers is just a link. It might have gone in one direction, it might have gone in the other direction. There may well be multiple importations of virus into these towers. Indeed, there might have been multiple importations into Altaqua College. These are, you know, communities that cross over between Truganina and these towers.
Is there any link to the quarantine? Is there any link to the quarantine?
So epidemiologically, we investigate where individual cases might have acquired it from. It doesn't tell us about generations back necessarily.
So are there students who live in the towers? Is that the link? Or?
There are families that are linked to Altaqua College, that's right.
Just on the issue of masks.
Yeah.
See calls out of Canberra and from the AMA for Victorians to be wearing face masks in public. Is that something you're formally recommending?
Not formally. I support the statement. I think National Cabinet will have an opportunity to hear Victoria's position tomorrow, and we'll hear out of that. But it's a statement I support, and you know, I think the issue with face masks is that they aren't perfect, but they provide additional protection for individuals, and at a broad community level, when there's high uptake, when you can't physically distance. It's an important additional measure. And right now in Victoria, in Metro Melbourne and Mitchell Shire in particular, we are trying to use all of the conceivable tools available to help us.
Where you're going to put people who want to have the towers into hotels, will that be?
So the model that will commence straight away with that will be there will be police there until it all transitions to Corrections Victoria. So it's just being sure that we've got the model right, so that will be available from as soon as people are in. But the idea would be Corrections Victoria, Justice staff will staff it.
Police will remain at all 9 sites?
At the moment they are. At the moment they're remaining, but not long term. So we will have a presence at those sites where there are no positives, just for surety. That's all, and to make sure people aren't breaching the restrictions, the stage 3 restrictions. But it will really, the rest of it will be a health and community response in those 8 towers. It will be the one where we have a more significant police presence.
And here it says the medical clinic marquees are being set up at each tower.
Yep.
Will that be mandatory for people entering and exiting the building to actually be tested? Not tested, but have their symptoms?
Yeah, so look, I might ask Brett, but as I understand the way that arrangement will work is there'll be a bit of a symptom test check. Yes, that people will, you know, or as they go through, they'll all get temperature checked. That's a bit different to mandatory, I suppose. We would expect to test everyone who goes into the building.
Has anyone
Yeah, so look, we've got an 85% success rate. People are being re-offered it today in terms of testing. Might have been people weren't there, they didn't answer the door. That's been a bit of an issue around language, so that's happening again. If people don't accept the test, they will have to continue to quarantine until the 14 days is up.
Will there be another testing, I guess, push, given some people may not yet have this virus, as Brett said? Will there be another testing blitz?
Yeah, so the temperature check, symptoms check and testing through the towers will continue to occur.
In terms of infringements that we've given out, do you have a latest tally so far?
Look, I don't. I had some this morning, which were from yesterday, which were 9, but there's a bit of a delay in that. The report I got at lunchtime today about the spot checks on the roadblocks, and it's probably changed since then. Firstly, traffic is so down. So in some places where we've got the roadblocks, the spot checks, and I should make it is spot checks, not everyone is being pulled over, but in some areas everyone is being pulled over because there's such a small number of traffic. In other areas it's about 200 an hour are being pulled over whilst we wait on 40k speed limits to be put in place to keep police safe. But we saw 6 infringements, a couple of vehicles who were turned around without an infringement and a couple of people who were arrested for trying to evade it as well.
And in terms of just the latest ones that you did have sort of yesterday, what
It was 9 infringements that occurred yesterday.
for the whole?
Yep.
Sorry, no, I mean from.
So yes, so that was
We're
yeah.
doing it from the new shutdown.
That's right. It was 9 from yesterday, so we're up to 96,000 checks from police now, all up, but only 9 infringements. And I was asked yesterday, am I confident people are going to follow these restrictions? My view is what we've seen in those restricted postcodes, people have been very compliant, have followed the rules. So I think people are taking this very seriously. Police will find people, and I think you'll see that number going up over the next few days. We saw yesterday a phone increase to the police assistance line up to 1,100 calls, and the day before it was 800. And so we're seeing people reporting in and reporting issues that they're seeing. So the infringement numbers will go up. But what gives me heart is I think since we had restricted postcodes, most people have been doing the right thing. And so I think they are taking this seriously as they need to.
Just with the 165 today, is that a bit of tower, a bit of community transmission, northwest?
Yeah, there are 30 that are linked to current outbreaks or complex cases in our 165 today. But a lot of them come in very late at night, so we don't reconcile exactly where they've all been acquired really, except over the next 24 hours, which is what will have happened today.
Okay, so you don't know if it's in these hot zones?
We do know the postcodes for a lot of them, so they are certainly represented in the hot zones in the northwest corridor in particular, but there are literally dozens of postcodes where there's 1 or 2 cases. So it's more widespread than just a few postcodes that have been part of the original restricted postcodes.
How many contact tracers do we have working in the state now, including the ones we've got from interstate?
So some of the interstate contact tracers are working in situ in their jurisdiction. They're able to link in with our data. It's a very useful way for them to assist us. All in all, I think it's over 1,000, over 1,300 potentially contact tracers.
In terms of the masks, sorry to go back to that. If people are wearing them more and more, are you confident that we've got a stockpile that's enough?
I think people will need to make their own masks. I don't think there should be a rush on buying single-use masks, for example, and some masks that are able to be purchased retail aren't necessarily good for rewashing and reuse over days and days. So as I think I've flagged in the past, we're working up the communications materials that will give a bit of guidance about how to make a basic mask that can be rewashed and reused so that it can be something that Melburnians and beyond use for several weeks to come.
And would there be any issue, I guess, further if you're vulnerable and you can't leave, would there be a push to try and get masks?
I think we need to think that through, but it's not a given.
Infectious diseases expert Lindsay Grayson wrote yesterday that DHHS is one of the worst funded and dysfunctionally organised health departments in the nation. What do you say to that?
Look, Lindsay's a mate. He's a very clever ID physician. I think every public health person in Australia is an advocate for resourcing for public health. We have contributed to half of the increase in life expectancy in the last generation. Public health punches above its weight. So I have been a tireless advocate for public health for years, and I would love to see public health get as much as it possibly can into the future. I think now my focus is absolutely on addressing this pandemic. There will be time for a review and for contemplation about any structural or resourcing issues long term after this.
Did you start on the back foot as a result of years of underfunding, as Lindsay seems to be saying in his article?
Look, I think we have a very competent and experienced public health team in Victoria. A pandemic of this type challenges absolutely everyone, but actually Victoria drove down cases in the same way as the rest of Australia. So I think we've done as well, if not better, than any other jurisdiction in Australia.
Are you confident that we're getting sort of up-to-date data on outbreaks, cases? So, for example, the Northern Hospital, we understand, notified publicly a fair bit after it was actually been detected by you guys.
No, we're getting those cases linked, within 24 hours by and large. So, as I say, a lot of the test results come in very late at night. They get interviewed from the morning the following day, and they get linked to our existing outbreaks, or we understand where they've been acquired over the next 24 hours. But the close contacts are a challenge. We're over 5,000 close contacts, and so I would say whether or not you get notification from us, and we've got automated SMS notification for close contacts, but whether or not you get a phone call, if you know that you're a close contact of a confirmed case, stay in quarantine, and we will provide you the fuller details about how you move through that quarantine period, when it ends, what to do to get tested and to be cleared.
Premier, active cases now in Geelong. Could this restricted zone be extended to other council areas?
Well, based on health advice, we have put stage 3 restrictions into Metropolitan Melbourne and Mitchell Shire. That advice can change in the future. It'll be based on case numbers. It'll also be based on the number of people who live in a given area also. But again, that advice can change, and if we want that advice to remain consistent, that is to say no more postcodes, no more parts of Victoria being under that stage 3, then the best thing that we can all do is don't go out if you're sick. If you're sick, get tested and follow the rules, everybody. And look, I think the vast majority of Victorians are doing that. You look at the traffic data today, you look at the city, you look at lots of different places, there's a clear sense that people are staying at home, and that's critically important. It isn't easy, no one's for a moment pretending that it is, but it is absolutely effective in pulling this virus up. To the point that Brett made earlier on, in terms of day by day, to Lundy's question, these numbers will bounce around a bit, but we've all got to be prepared to see them go up before they start to stabilise and then come down again. That was the story, that's the way the curve works. Even at the other end of this 6-week period, though, I wouldn't want people to think that just because we'd had a single day of 0, or just because we had lower numbers than the numbers we've been reporting these last few days, that we could ease off, if you like, or that there's an automatic opening up at the end of that 6-week period. It's really dynamic. It moves so fast. It's so wildly infectious that we've just got to be on our guard, and that's exactly what we're doing, and it's something that I think every Victorian can play a part in, and I'm deeply grateful to the vast majority of Victorians who are doing the right thing. And some of that infringement data, as well as the points I made about traffic and movement in the city and out in the suburbs, really I think confirms that.
Should parents in Victoria have some confidence that kids go back to classrooms, given you've announced this idea of mandatory temperature checks for all school kids when they go back to class?
No, I think you should see the introduction of mandatory temperature checks much more about the fact that we have kids going back, young adults going back to school on Monday, year 11 and 12, so there are going to be students there. There will also be, for those 5 pupil-free days under the extension of the school holidays, there will be the children of a number of people who can't work from home. So given that those environments are no longer on school holidays, there won't be as many kids, many students, but there will be some that's all about an abundance of caution. We've not made a final decision in relation to remote learning. As soon as we can give parents the maximum notice, then absolutely we will do that. There are some very real issues here in terms of the number of people moving around, as well as we have seen transmission in schools. All of those things have to be weighed up, and we've got to make that really difficult judgment between the public health reward that would come as part of this suppression strategy trying to drive those numbers down, and the risk to individual health, and the risks in a broader sense that if you were to carry on as usual, would that be compatible with us driving numbers down? Would that be compatible with getting to the end of this 6-week period and having a fundamental sense of control over this? And they're difficult judgments. I know that there's no parent would enjoy the notion of homeschooling for another 5 weeks, as it would be, but we have to look at those matters really, really carefully, and there's still some work to be done there, Rich.
Lots of businesses have flagged that they're really going to suffer, and a lot of have said that they're going to shut down permanently as a result of this latest shutdown. Is there more assistance?
There will be. There will be further assistance. We've been having conversations with the Commonwealth Government in relation to their settings. As you know, they have an economic statement due on the 23rd of this month. The Prime Minister, as well as the Treasurer, both to me and to Tim Pallas, has confirmed that that whole notion of hardship is going to continue to drive the Commonwealth Government's response. We're on the record many, many times saying that JobKeeper and JobSeeker, those changes really put a floor under things, absolutely saved so many businesses, but we know that there will be more hardship in Victoria, particularly metropolitan Melbourne, than there is in other parts of the country, and I'm reassured to think that hardship is going to continue to drive the Commonwealth's policy response. It's always driven ours, and we'll have more to say about Victorian Government support for those businesses that are worst impacted by this. That's not tonight, but we will have more to say as soon as we've done that work. And I think you can probably appreciate that whilst the Commonwealth Government have their own decisions to make and they've got their own timeline around the 23rd of this month, it is important that we try to be as coordinated as possible so that the things we do and the things that they will announce, maybe do later on, again, I'm not wanting to make announcements for them, we've got to make sure that they work together well and that they complement each other and meet the needs of businesses.
Is there any concern that businesses might need a little bit more help?
Sorry, Alex, I didn't get the beginning.
Is there any concern that small businesses will need help sooner before the 23rd of July?
Well, that's not a matter for me. Our package will be done well before the 23rd. Sorry, I'm just talking about we're trying to do the work now to be as coordinated as we can. But the Commonwealth Government, I'm not in any way being critical. I'm just saying they're on a slightly different timeline. But getting a sense of where they're perhaps moving to is of great benefit to us as we design our business support response. That will not be the 23rd. That'll be before then, but it isn't tonight. It'll be quite soon, though.
Premier, big crowds reported on the Mornington Peninsula gathering in Washington, Wales. How does that make you feel, given the message?
Well, regardless of what you're watching and regardless of where you are, the rules are the rules and they need to be followed. And, you know, I've been pretty clear with people. You've got to call some of this stuff out. And I don't know the specifics of that example, but Victoria Police are not mucking about. And if you're breaking the rules, then you will be fined. There's not going to be too many warnings given out. There just can't be. We've got to make this 6 weeks, we've got to give ourselves every chance that at the end of it, we've got the numbers down to a very low number that we can control and maintain. If we all go and find one reason or another to do something that isn't really in the spirit or indeed compliant with the rules, then we just won't achieve that number. Our numbers, our case numbers, will be at a still unacceptably high level. Nobody wants that. And as clear, I'm trying to be as clear as I can. Victoria Police are out there in force, and if you're doing the wrong thing, there's really no excuse to be doing the wrong thing.
Are we pursuing suppression or eradication?
Well, we have a national cabinet decision around suppressing the virus. There are other cases in other states. There are some states that never had any community transmission and therefore got to a place where they have 0 cases. That's the national cabinet position. I think if you were to choose the absolute, if you want to try and eliminate this completely, World Health Organisation, the way they define that, we would need several 14-day cycles of 0 cases before we would qualify for that. What we're trying to do is get this back into a contained space, into a suppressed space, noting that there will be some additional cases, some additional outbreaks, but they've got to be at a size and scale that you can manage, not at a size and scale that means you've got to go back to a stay-at-home order. Again, anyone who's doing the wrong thing, then you put at direct risk us being able to open up again at the end of that 6-week period. It could be longer if people don't take it seriously. But again, just so there's no confusion in any sense, we're all deeply grateful to everyone who is doing the right thing, and I think that is the majority of people. But there'll always be some who don't, and that's why Victoria Police are out there, and they'll be issuing those $1,652 fines. And whilst there were a lot of warnings, to quote the Chief Commissioner from yesterday, there were a lot of warnings that were given out, many more warnings than fines. The last time we had stay-at-home orders under Stage 3, that will not be the case this time. There'll be some discretion, but much less than was the case a couple of months ago.
Can you explain where the Army's and the Defence Force is being deployed?
A whole range of ADF personnel arrived today. I spoke with the Prime Minister about this just before his news conference today. I think our total allocation is about 264, 65. They'll be providing support to Victoria Police in a whole range of different tasks. You'll see them out and about supporting Victoria Police in terms of those checkpoints, those roadblocks between metropolitan Melbourne and regional Victoria. There'll be a number in the State Control Centre to add to about a similar number are already here, doing everything from clinical work, doing mass testing, supporting the State Control Centre and a whole range of other functions. We're essentially doubling the number that we have. It may be to come back to you with some once, because they don't all come at once. There's a whole lot have arrived today, but that's all going according to plan.
So could Victorians be pulled up by a Defence Force officer at a roadblock? No, because members of the Australian Defence Force have no power to do that. They'll be supporting Victoria Police in Victoria Police exercising their powers. What does that mean, though?
Well, it means a whole range of different things. Every checkpoint is different, every part of the operation is different, but there are a whole range of specialist roles that will be performed by ADF, but we can't have ADF pulling people over. They're not members of Victoria Police. Victoria Police are going to do that job, but they made it clear to me that they would benefit from having some ADF support. We asked for it, and I'm grateful that the Prime Minister has agreed, and that adds to a significant ADF presence in our pandemic response, everything from the State Control Centre to the Melbourne Showgrounds, where they've been assisting with everything from broad statewide planning all the way down to taking tests at that mass testing site.
Just in terms of the judicial inquiry,
Yes?
in your opinion, would you like to see public hearings so people can get a real idea and understanding?
That's entirely a matter for former Justice
At
Coate.
that point, though, the terms of reference were written by your government and it wasn't recommendation of you, so under your opinion, your opinion...
Well, I'm not about offering opinions, Alex. If you read those terms...
You have no opinion on whether it should be a transparent process or not?
If you read the terms of reference, former Justice Coate is free to conduct her inquiries in any way that she believes appropriate. To your final point, I would not accept your characterisation of me not supporting a transparent process. That's, I don't think, fair and accurate. Transparency is very important, but how many hearings, the nature of those hearings, who gets called to those hearings, that is appropriately a matter for former Judge Coate. I've said a few times in recent days, it's not about the government sitting in judgment of itself. That should be done at arm's length, and it will be.
To the terms of written references that was written, it clearly states government agencies, private security operators and hotels, that clearly this is out the ministry as well as the department. So are you saying that if we're going just by the terms of reference, that those people do not have to appear before the committee because it's actually outside of the terms?
No, I think we're in furious agreement, Alex. I'm pointing out to you that in my reading of the terms of reference, the former Justice Coate is not prohibited in any way as to who she investigates or how she does that work. But it's not for me to speak for her as... Sorry? Sorry?
If she wants to call up a minister to the inquiry...
Well, that's entirely a matter for her. Entirely a matter for her, as it should be.
With ICU beds,
Yes.
in the public system, is that running at high capacity right now, even without large numbers of COVID cases? Are we looking at a situation where we might have to move into that surge capacity for ICU?
In terms of the private system, you mean?
In terms of the public system right now.
Sure. Oh, well, you'd have to always look at the number of cases that were coming forward and the individual clinical circumstances of each one of those cases. We've got sufficient, in fact, we have very large stockpiles of everything from PPE to machines to help you breathe and everything in between. We've got the trained staff. We've got a number of physical spaces that we have completely refitted, whether it be the Peter Mac or others. We are confident that we've got everything we're going to need, and then we've erred on the side of caution as well. Again, that's really in the hands of every single Victorian. If we all play our part, if we all do our very, very best to follow those rules and to not contribute to the spread of the virus, then we will see not no one in hospital, but we will see less people in hospital and therefore less people in intensive care. But all the advice I've got, Noel, is that we've got sufficient, indeed more than sufficient supplies, reserves, if you like, to be able to deal with any part of this pandemic, noting that it's not just for the next week or the next 6 weeks. This is going to be with us for a very long time, given that a vaccine is the ultimate answer, and it's not going to be here anytime soon.
Do you know how many beds we're able to call upon?
I'm happy to come back to you. Again, there's, I suppose the best way to look at it is how many patients can we treat. So the bed, whether it's a high dependency unit bed or it's an intensive care unit bed, where the bed is located, we've seen you've got to be flexible, you've got to be as dynamic as you can be. I'm more than happy to come back to you and give you a sense of surge. The other thing too is we've had a really strong partnership with the private sector, and if we need to re-examine elements of that now that we're in this second wave, then of course we would do that. That partnership has served us very well. It's a public and private system, but it's one health service for the purposes of pandemic.
Did you head out the night before the lockdown came in, in the last couple of hours before lockdown came in? What did you do to celebrate before?
I was at last night. You mean?
Was it last night?
I was at home with my family.
All the time?
Yes, I was at home with my family. And sorry, you want to ask me about the night of my birthday as well? Do you want to do that? Yeah, I was at home having a very nice family dinner. Let me indicate to you when that occurred, Alex. That occurred after I'd done, I think, a 2.5 hour cabinet meeting over Zoom, and then we had a very nice, albeit I think my plate might have been a bit cold, but you know, we're all doing all sorts of different things, but I was very pleased to be at home with my parents. Sorry, at home with my wife and my kids. They happy? Fine?
Yes.
Very good. Is it? Are there any other questions? Now that I've got all flustered. Any other? No? Very good. I'm going home to them now as well. Thanks.